Hi, good morning. I don't have any relevant disclosures. And I do agree with everything that people have said up on the podium before me, and I will send patients home on postoperative day 0. But it is important to know that same-day discharge is not for everyone. I'm going to talk about this first from the patient perspective, which has been glaringly absent from what people have already spoken about. Surgery is scary. 70% of patients will have extreme anxiety before surgery and 100% after surgery. This includes even the most informed patients and patients that have had surgery before. In essence, patients don't know what they don't know. So you have to ask them. From a focus group of 20 patients from the ACP GBI Patient Relations Group, these are exact comments from patients when asked about same-day surgery. One physician said, "How could I be ready in 1 day? Are we in the hospital until we are well or until we can cope? It seems that doctors are just trying to push you out." And another said, "We had just done a study with the patient and public involvement events, and patients were very clear. They wanted to stay until they felt ready to go home. Not when the doctors felt they were ready. If that was day 3, great, or if it was day 10, then also great." This is Nicola Dames, who is a nurse and a patient advocate. And it's a video describing her interpretation after people were asked on social media about same-day discharge.
And it's really important that you hear the patient's point about this. So, although there was a lot of people who thought it was a good thing in theory, but in practice it would be something else, and there was other people who were fans of the rapid discharge process, but also thought that 24 hours was really, really scary. Others thought it was an awful idea, and others questioned the motives of who was the beneficiary here. And for me personally, I am a fan of rapid discharge, but when in 2006, and it's really important that you hear the patient's point about this. So, although there was a lot of people who thought it was a good thing in theory, but in practice it would be something else, and there was other people who were fans of the rapid discharge process, but also thought that 24 hours was really, really scary. Others thought it was an awful idea, and others questioned the motives of who was the beneficiary here. And for me personally, I am a fan of rapid discharge.
We're looping here.
But when in 2000.
So from the focus group, we can see that one size does not fit all was what patients really wanted us to know. And surgeons have different perspective of what's important after surgery than patients do, as well as their outcomes. The enhanced recovery extremes are not suitable for everyone. The things that they were most concerned about was the actual discharge process and how they could contact their surgeons after discharge, which they didn't have success with. And they also wanted us to know that there are issues that they have at home that we don't consider when we're discharging them. For us to be able to do same-day discharge, patients need appropriate education so that they know what to expect, that's acceptable and what's unacceptable deviations from what to expect and what to do precisely in each scenario. They have to be queried about their support at home to ensure the necessary technology is in place if we're using technology, that it's tested, and that they're trained on it so that they're able to use it. You also have to assess targeted education and make sure that it's targeted at their appropriate language and education levels and reading levels, and give virtual support that's available to them at their fingertips 24 hours a day, 7 days a week, as well as giving them a direct connection to the surgical team, a direct pathway to be evaluated, and a direct pathway for admission. Hard ass. From the facility's perspective, as we've already talked about, enhanced recovery works. Putting an enhanced recovery model in place is hard work though, and at this point in time, about 40% of centers don't have a comprehensive enhanced recovery after surgery process. Just for enhanced recovery after surgery to work, this is the multidisciplinary steps. Going through the same model for same-day surgery is a little bit more difficult. Essentially, any person that your patient is going to interact with during their hospital stay or during their hospital readmission is going to need to be both aware and supporting same-day discharge. Again, that's a pretty hard ask. You're going to need extra people for this. There's going to be new roles and extensions of the current roles that people are doing for monitoring, ensuring compliance, ensuring education, care management, and passport services to move patients through this. And something that's very important that we're not talking about is the inclusion criteria for same-day discharge may be drawing a line in the sand between the haves and the have-nots and actually making care inequitable. You're also going to need extra space, which is hard to pull out of thin air. In the post-anesthesia care unit, which is usually a bottleneck already in most hospitals, and when patients come back in the emergency department, in the ward, for radiology to streamline admissions and evaluations, and also in the operating room if there's a complication. And you're also going to need extra money, which is also difficult to come by, to pay for the staff, the preoperative and postoperative needs of them, the facilities needs, technology, wearables, and other home monitoring equipment, and the time for that, which is usually about 18 months to get through most centers, as well as any changes that need to be done with liability and malpractice insurance, in addition to dealing with issues in reimbursement. From the surgeon's perspective, we know it sounds good to get patients home earlier, but patients really don't care about that. And the reality is that we have a very poor perception of what patients understand about the surgical process. And patients also don't feel comfortable or able to ask questions, and we are unaware of that as well. And different priorities for care. As was already said, the length of hospital stay is one of the least important priorities for patients after surgery. So we practice evidence-based medicine. There's little evidence right now supporting same-day surgery. Dr. Lee already presented his study, and this is a very well-primed center for enhanced recovery with discharge monitoring that's in place, and still more than 25% in pretty simple cases were not able to do this. And the study from Mayo Clinic, which is another very well-established and well-monitored enhanced recovery center, included patients that were discharged on post-operative day 0 and post-operative day 1. So not really the same. However, there is published literature that says that this is both experimental and dangerous. So we need to be aware of that. Because this is a risk we're accepting if anything goes wrong. People can say that same-day surgery is not the standard of care, but enhanced recovery is. The surgeon also has to be available, affable, and aware of that patient 24 hours a day, 7 days a week, 365. And they have to ensure that there's seamless communication to get that patient through the system and that all parties involved, again, are aware and buy into this for it to work. So in conclusion, in about 25 years, we haven't gotten much further. This was written by Dave Schetz in 1997 about the ideal length of stay after colectomy, saying that caution has to be exercised and that there's these uncontrolled variables that are involved in defining the ideal patient. It's still true. This was just done last week, this poll about same-day discharge. So it may be a natural extension of enhanced recovery. If patients meet defined discharge criteria on post-op day 0, fine, send them home. Natural evolution there. But it's not for everyone. And patients are going to actually select themselves out for who's ready to go home. We don't need to tell them. So the goal is for them to recover better, not just faster. Thank you.